Hi, my name is Amber Tippett, and I am against a single payer healthcare system in the United States, and these are the reasons why. So, to start off, we have our scientific argument. Um, you know, it's universal healthcare is such a debate, and you have one side where you think um, everyone does deserve healthcare and access to it. And then on the other side, we have the reality of, actually implementing it into our healthcare system. And we can take a look at Canada as an example that has actually implemented it. And according to the data, approximately 30% of Canadians are waiting longer than 6 months to have hip and knee replacement and even cataract surgery. So when you look at that in a bigger aspect, you're waiting longer than 6 months to walk or to see, or at least be able to, you know, clearly see. Um, and I guess that goes hand in hand with like the ethical argument of it too, because you're also, when you start supplying patients with Medicare or not Medicare, universal health care, it's going to flood our system. And what I mean by that is if everyone gets access to healthcare at the same time, our wait times are going to increase dramatically because patients that haven't had access to healthcare are going to come in and they're going to, you know, um, they're going to talk about the things that they've been putting off for so long because they couldn't afford it or they didn't have access to it. So for example, you go into a doctor's office now and you usually have 5 or 6 people ahead of you, depending on the doctor's office. Well, once everyone starts getting access to healthcare or, government funded healthcare, it's now going to be, 10 to 15 people in front of you, and that's going to increase our wait time. So, next, I'm going to lead into the legal argument of it. The World Health Organization, also known as WHO, I think we should all know who that is by now. They state that one of the laws set in place to take care of us citizens and healthcare workers is managing and responding to risks to personal health and a country's health security. So, let's just say, we go into a hospital now, and I don't think anything's going to change, but now it's you go into a hospital and you could wait 5 or 6 hours to be seen for something minor. Well, you now have everybody else coming in from, small to big issues, and they're always going to take the patients with the more serious issues. So you could be waiting in a hospital for a day to even be seen, depending on um, your situation or your symptoms that you're experiencing, or what's happening with you. This could essentially create potential risk to both physicians and the patients. So the longer you wait, the more irritated you begin to get. And let's just say you've been waiting in a hospital for 12 hours to be seen, and you end up taking it out on hospital staff. Well, now they're in danger, and you could be putting other patients in danger as well, just for the fact that they're having to wait so long, even though they might seem like they're having minor issues. But not being able to evaluate them in time could also be detrimental to their health as well. Lastly, I want to talk about the economic argument aspect of it. Economically, this would dramatically increase our taxes. We always complain about how many taxes we have to pay now. Well, the funding for everyone's healthcare has to come from somewhere, and that's going to come from taxpayers. So it's gonna make the price of living go up, and it's going to make our taxes go up, and it's essentially going to make those people that couldn't afford healthcare, they might have healthcare, but they might not be able to afford anything else. So it's Do you want them to be able to have a house and have food in their homes, or do you want them to have access to healthcare? Ideally, we would like to have give them both, but at this time, it's just not feasible. And all these issues are it's the big reasons why universal health care is not the answer for America right now. As much as we would like it to be, it's just the realistic or the reality of it. It's just not going to play out as easy as everyone would think it would. Thank you.